its second oxygen express with 120 metric ton liquid oxygen. Telangana receives its first oxygen express with 63.6 metric ton liquid oxygen. Supreme Court issues directions to centre and states on COVID-19 management. Supreme Court tells centre to ensure that the deficit in the supply of oxygen to Delhi is rectified on or before midnight of today. Centre will formulate a national policy on admissions to hospitals to be followed by all state governments. Amid rising corona cases, Odisha and Haryana extend lockdown. Punjab too issues new guidelines in view of COVID-19. Nobody to enter the state, whether by air, rail or road, without either a COVID-19 negative report or vaccination certificate. Ruling parties retain power in 3 states. Trinamool registers big win in West Bengal, though Chief Minister Mamata Banerjee loses Nandigram. BJP set to return to power in Assam, and Left Front wins in Kerala for the second term. In other 2 states, DMK registers big win in Tamil Nadu. NDA wins in Puducherry. Prime Minister Narendra Modi congratulates the winning parties. DMK is all set to form the next government in Tamil Nadu. Party President M.K. Stalin to meet newly elected legislators tomorrow to formally elect the new legislative party leader. Prime Minister Narendra Modi to hold a virtual summit with his UK counterpart tomorrow. A comprehensive roadmap 2030 will be launched during the summit, which will pave the way for further expanding and deepening India-UK cooperation over the next decade across 5 key areas. Both leaders will also discuss efforts to fight the COVID-19 pandemic. And on the occasion of birth centenary of legendary filmmaker Satyajit Ray, Ministry of Information and Broadcasting announces special award. Information and Broadcasting Minister Prakash Javadekar remembers Satyajit Ray as the great filmmaker who established India in global cinema. Well, let's start with our national stories. The centre and states are putting in all possible efforts to prevent the rapid spread of COVID-19 and maintain seamless supply of oxygen, medicines and other essentials required in the treatment of the infection. India yesterday witnessed a small but significant development. The country yesterday recorded 3,69,942 new cases of coronavirus infections, which is less than the previous 2 days' tally.
As the war against COVID-19 continues unabated, Prime Minister Narendra Modi is leading the efforts to mitigate the crisis, exploring innovative ways to ramp up supply and availability of oxygen. Prime Minister Narendra Modi has been holding a series of meetings with various stakeholders every day to keep a close watch and address the evolving situation. The Prime Minister today held a virtual meeting with experts to review the availability of oxygen, medicine and human resources to deal with the COVID-19 pandemic. The Prime Minister also reviewed progress of converting nitrogen plants to oxygen plants. Government explores feasibility of conversion of existing nitrogen plants to produce oxygen. Government identifies potential industries for production of oxygen. Nitrogen plants use carbon molecular sieve, CMS. Zeolite molecular sieve, ZMS, is required for producing oxygen. Replacement of CMS with ZMS to produce oxygen. So far, 14 industries have been identified where conversion of plants is under progress. 37 nitrogen plants have also been identified with the help of industry associations. Nitrogen plants can be used for on-site production of oxygen. Apart from this, Prime Minister Narendra Modi reviewed usage of gaseous oxygen for medical purposes. Many industries like steel plants, refineries with petrochemical units, industries using rich combustion process, power plants and so on have oxygen plants which produce gaseous oxygen which is used in the process. This oxygen can be tapped for medical purposes. The PM also reviewed identification of industrial units which produce gaseous oxygen. Steel plants, refineries have oxygen plants which produce gaseous oxygen. This oxygen can be tapped for medical purposes. 10,000 oxygenated beds are expected to be made available in a short period. State governments have been encouraged to set up more of such facilities. The Prime Minister also reviewed the human resource situation in dealing with the COVID-19 pandemic and ways to augment it. Bureau Report, DD India.
And the Supreme Court has told the centre to ensure that the deficit in the supply of oxygen to the Delhi is rectified on or before the midnight today. It has further advised the central government in collaboration with the states to prepare a buffer stock of oxygen for emergency purposes and decentralize the location of the emergency stocks. The emergency stocks shall be created within the next 4 days and is to be replenished on a day-to-day basis, in addition to the existing allocation of oxygen supply to the states. Central government and state governments shall notify all Chief Secretaries, Director General of Police, Commissioner of Police, and that any clampdown on information on social media or harassment caused to individuals seeking delivering help on any platform will attract a coercive exercise of jurisdiction by the court. A copy of this order shall be sent to all district magistrates in the country. Centre will formulate a national policy on admissions to hospitals which shall be followed by all state governments. No patient shall be denied hospitalization or essential drugs in any state's UTs for lack of local residential proof of that state UT or even in the absence of identity proof. Right, to give us more information on this, my colleague Vikas Sarthi joins me from Delhi. Good morning, Vikas. First of all, Supreme Court has issued directions to centre and all states on COVID-19 management and also emphasize on the oxygen supply. What more can you tell us?
Good morning. The main idea behind this order of the Supreme Court is to streamline the process involved in COVID-19 management. In fact, Supreme Court had also said that it is not going to interfere in the issues already being addressed by the different high courts. But Supreme Court had identified certain important points, and on those points, Supreme Court has given this directions. The first, as you were saying earlier, that the demand of Delhi for oxygen must be fulfilled by 3rd of May midnight. That must be ensured by the centre as well as the state government. Apart from it, court has also said that there were some cases where people were denied treatment in other states. So the court said that it doesn't matter where a patient, which state a patient belongs to. By the time centre comes up with a national policy within 2 weeks, no person should be denied any treatment on the basis of their residence. And in fact, even a person doesn't have any kind of identity, he should be given proper treatment in these COVID hospitals or at special facilities. So
right.
People should not face any kind of harassment on those grounds. Apart from it, court was also of the opinion that instead of transporting oxygen on day-to-day basis, centre must identify some specific points, specific locations for oxygen buffer, and this, and also that these buffer stocks should be decentralized. They should not be placed in a particular state or a particular city. Decentralization is very necessary. And the third important thing is that court has said that states and center should also consider about imposing a lockdown. So court has requested states particularly that they should analyze the situation in their respective states and should also consider about imposing a lockdown if it is needed.
Okay, if there is any need for the lockdown, then they should also consider this. Tapas Bhattacharya is also with us from Delhi. Good morning, Tapas. Vikas, you stay with us. Tapas, first of all, there were over 20,000 cases that were registered yesterday in Delhi. and the positivity rate has come down slightly since April 19. It has gone down below 30 in Delhi. A sigh of relief, and National Capital received second oxygen express also. If you can elaborate more on that.
Yes, so Abhishek, let's just give you the facts first. Yesterday, the total number of positive cases that came out in the last 24 hours was 20,394. And the positivity rate that you rightly mentioned was below 30. It was 28.33%. But the point that that was to be worried about here is that the number of tests that's conducted was just over 71,000. In fact, 71,997 tests were conducted, which is again much less than what Delhi used to conduct in the last, if you go back to almost 3 weeks. Earlier, it used to conduct almost 90 to 1 lakhs tests, and that's one of the reasons why the dip in the testing is a cause of concern. And the second major cause of concern is the number of fatalities, which is still over 400, 407 to be precise, though we believe that the fatality numbers will come down in due course of time. But as of now, these are two major important points that have that is a worrisome factor for Delhiites. And the third thing that is worrisome is the paucity of oxygen. Even yesterday, we saw a lot of hospitals taking the social media, scurrying for oxygen, going out of their way to ask for help, because many of these hospitals are running out of oxygen. And those are a few things that needs to be tackled in due course of time. The center is leaving no stone unturned. It has already issued directives to make sure that Delhi gets the desired number of oxygen, its desired number of oxygen quota. Remember, Delhi earlier had 490 metric tons of oxygen quota, but it has been revised to 590. But even then, this particular quota has not yet fully been utilized by the state because of a paucity of oxygen cylinders. So the central government is chipping in to make sure that that can be resolved. The other point, what is quite baffling. Can you hear me, Abhishek?
Yeah, go on, Tapas. We can hear you.
Yeah. The other point, Abhishek, that is that can bring a smile to the faces of Delhiite is the fact that the second, after the second oxygen express that came, the third is expected to reach Delhi from Orissa, and it is expected to reach Delhi by today or by tomorrow. So we are expecting another 30 metric tons of liquid oxygen from Odisha. So earlier 120 metric tons of oxygen yesterday we reached. Yesterday in fact reached from Durgapur. So that is going to definitely help mitigate the crisis for the time being. But what is important, what is very much required, is a constant supply of oxygen. Remember, most of the fatalities that we have seen in the national capital is because of paucity or a non-availability of oxygen in hospitals. In fact, most of the top hospitals in the national capital is grappling with that. We called almost every hospital yesterday, all the big hospitals, and everybody is saying that there is a paucity, there is a shortage, especially of the ICU beds are critical out here with ventilator, and that is where the problem lies. And some of the what you call NGO, some of the other people have started the have taken things in their hands. But the major thing is that the Delhiites is still grappling with the supply chain of oxygen.
Yeah.
Yes,
absolutely, Tapas. And the third and largest phase of vaccination will also start in Delhi from today. That's what we are hearing. I'll ask you a question on that. You stay with us. But Vikas, he's still with us. Vikas, Supreme Court orders that the central government within 2 weeks should formulate a national policy on the admissions to hospitals, which shall be followed by all states. If you can elaborate more on this.
Right. The Supreme Court is of the opinion that as of now, different states have different policy with regards to the admission and home isolation. So court said that center should come up with a national policy that at what point of time a patient should be hospitalized, who can be treated under home isolation. So there should be a national policy which must be followed by all these states. And meanwhile, the court also said that it doesn't matter where a person resides. If a person needs treatment, even if he's in other state, he must be given COVID treatment as early as possible. So all those aspects should be covered in this national policy, which must be brought by a center within 2 weeks. So the idea behind this policy is to bring a specific guideline that what should be the criteria for hospitalization and home isolation, and apart from that, to streamline these, to remove these kind of issues, whether a person should be treated in his home state or he can be given treatment in neighboring state where medical facilities are better than other states. So these are the issues which should be dealt in this national policy.
Right, Vikas, thank you for bringing us up to speed on COVID, and Tapas, thanks to you also for giving us those vital inputs. Well, moving on, Oxygen Express of the Indian Railways continues transporting oxygen on mission mode across the country. The lifeline of the nation becomes a lifesaver for COVID-19 patients by ensuring swift delivery of oxygen to various states. National capital Delhi received its second Oxygen Express with 120 metric ton liquid oxygen. The train has brought oxygen from Durgapur. Oxygen Express from Angul, Odisha has reached Secunderabad, Telangana, carrying oxygen to the state for COVID-19 patients. Indian Railways has cumulatively delivered more than 1,094 metric tons of oxygen to Maharashtra, UP, MP, Delhi, Haryana and Telangana. And strengthening the capabilities of the nation in the united fight against COVID, the Ministry of Railways has, amongst its multi-pronged initiatives, deployed nearly isolation coaches with beds. In recent efforts, Indian Railways has deployed 10 isolation coaches at Dimapur, Nagaland. 213 COVID care coaches with a bed capacity of nearly 3,400 have been handed over to states and are being utilized in Delhi, Maharashtra and Madhya Pradesh. These isolation coaches can be easily moved and positioned at places of demand on the Indian Railways network. Further, 11 COVID care coaches have been prepared at Aini in Nagpur, which will be used for isolation of corona patients. Various facilities have been provided in these coaches for medical staff and patients. And Odisha government has also announced a 14-day lockdown between May 5th and 19th to break the chain of transmission as the state sees a spike in COVID cases. Complete lockdown will be observed on the weekends, while restricted movement will be allowed on the weekdays. People will have access to groceries that are in a 500-meter radius from their homes between 6 a.m. and 12 p.m. as per the state orders. Haryana has announced complete lockdown from today till May 9th in view of rising COVID cases. Chief Minister announced this while interacting with media at Sirsa yesterday. Gurgaon, Faridabad, Panchkula, Sonipat, Rohtak, Karnal, Hisar, Sirsa and Fatehabad are the highest contributors to the state's COVID-19 caseload. Chief Minister Manohar Lal Khattar had earlier asked authorities to take strict action against anyone found indulging in black marketing and hoarding of medical oxygen, cylinders and other medical devices or antiviral injections used in the treatment of COVID-19 patients.
एक सप्ताह के लिए 3 मई दिन सोमवार से पूर्ण लॉकडाउन हरियाणा में लगाया जाए ताकि इसकी चेन को तोड़ा जा सके। बाकी सारी परिस्थितियां हमारे नियंत्रण में हैं, हम सारे इंतज़ाम कर रहे हैं और पेशेंट्स को ट्रीटमेंट मिले उसकी सारी व्यवस्था की जा रही है।
And in view of the alarming rise of COVID-19 cases in Punjab, the state government has imposed stricter curfews in the state till 15th May. And as per the orders, nobody should enter the state, whether by air, rail or road, without either a COVID-19 negative report not more than 72 hours old or a vaccination certificate of at least one dose over 2 weeks old. All shops selling non-essential items will remain closed, while essential ones will remain open. Essential items include chemist shop, shop selling vegetables, fruits, dairy and poultry, and mobile repair shop. No restrictions imposed on laboratories, nursing homes and all other medical establishments. Maharashtra now. People from across Maharashtra who have recovered from COVID-19 have shared their experiences with the positivity that one can overcome the virus by following COVID appropriate behavior at home and by following government protocols. They have also shared the importance of yoga, which helps us build strong physical, mental and spiritual health system. Let's listen in.
मेरे पास ये मैसेज आया कि मैं कोविड-19 पॉजिटिव हूँ। डॉक्टर्स ने मुझे सलाह दी कि आप अपने आप को होम आइसोलेट करें और उन्होंने कुछ मुझे दवाइयाँ दी, किट्स दी। डॉक्टर्स ने जो बातें मुझे हिदायत के रूप में दी थी, मैंने उसे मंत्र के रूप में स्वीकार किया और अपने घर में रहते हुए मैंने घर में रहने के दौरान भी मैंने मास्क का नियमित रूप से इस्तेमाल किया। हाथों को लगातार साफ करता रहा सैनिटाइजर और साबुन से। मैंने तो होम आइसोलेशन में रहते हुए अपने आप को पूर्ण स्वस्थ किया। मैं आज आपके सामने हूँ। उम्मीद है हम और आप सभी होम आइसोलेशन में रहते हुए कोविड-19 की गाइडलाइन का पालन करेंगे और कोविड-19 के खिलाफ जो एक जंग पूरे भारत में इस समय लड़ी जा रही है, अपने आप को एक वॉरियर, एक योद्धा के रूप में हम और आप सब स्थापित करके उस जंग को जीतने में एक महत्वपूर्ण भूमिका निभाएंगे।
Right, very positive message coming out there by the people of Maharashtra, and it's very, very important to follow the government protocols and also to wear masks like we are following in DD News and DD India also. And if you are eligible for the vaccination, go and get yourself inoculated, and most of us are now, since the third phase has also started. And now, right, let's listen in now to more visual bites and what people of Maharashtra are saying.
कुछ ही दिन पहले मुझे कोरोना में पॉजिटिव आया था, लेकिन उससे मैं डरा नहीं। मैंने अपना मनोबल अच्छा रखा और डॉक्टर की पूरी सलाह से दवाइयाँ ली और जो भी खाने के या प्रोटीन्स जो खाना है वो अच्छी तरह खाया, विटामिन सी या जो भी है वो अच्छी तरह खाया, व्यायाम किया, प्राणायाम किया। मुझे लगता है कि आज 15 दिन हो गए हैं।
स्कूल चालू करने के लिए जब शासन ने हमें RT-PCR करने की सलाह दी तो हमने RT-PCR टेस्ट की, वहाँ में पॉजिटिव पाया गया। तो तुरंत मुझे जिला रुग्णालय ओरस में भर्ती करा दिया गया। वहाँ पर मैं 10 दिन रहा। वहाँ में मुझे अच्छी तरह से खाना, प्रोटीन युक्त खाना और सही समय पर इलाज किया गया, इसलिए मैं 10 दिन के अंदर पूरी तरह तंदुरुस्त हो गया हूँ।
Right now, our correspondent Shama Mishra is joining us live from Mumbai. Good morning, Shama. First of all, Maharashtra reported nearly 56,000 cases yesterday and 669 deaths. Cases are slightly less, but again, death toll is a concern, and the positive rate is around 17.08%. New cases less, but again, death toll, it's not a good news.
Right, we have been talking about this this particular fact that the fatalities are not coming down, and overall Maharashtra figure is also not coming down. But yesterday we did see that the number had come down slightly below the 60,000 mark, and this has been the 65,000 to 66 till 66 has been the plateau, and this has been for a week now. So we could say the Maharashtra total positive cases has reached the plateau, and we may see the downfall from here on. But places like Mumbai, which had been registering maximum number of positive cases, it has been showing good results, and Mumbai has been showing positive cases in the range of 3,000 to 5,000 every day, and this has been a consistent record every day. So we could say that in Mumbai at least, the effect of more treatment, more tests, more treatment, more stringent measures that had been put, those things are showing the results over here. But yes, the death toll in Mumbai also, it was above 70, and this is a matter of concern. Apart from that, we are also seeing stringent measures that are being put in place. So till 15th May, already the lockdown like stricter measures are there. But apart from that, we are also seeing that police have been doing a stricter checking on the roads, and that is leading for people to not come out of their homes unnecessarily. Also, people have become more responsible and started following COVID appropriate behavior, even if when they are most of the people are doing so, but then there is a percentage of population which does not follow that. Even in the places which is like the marketplaces, or especially when the time when the shops are open, that is 7 to 11. So when those people are going to do some shopping, even then they are wearing the masks properly, and now people are more aware of the fact that they should be wearing double masks. So many people are also wearing double masks. Here another fact is important, that the disposal of the mask is another important factor, and through DD News medium, we would like to tell them that do cut their the surgical masks and the disposable masks, do cut them in half and then only throw. Otherwise it will be just lying around on roads, and it will cause another menace. Talking on the Maharashtra situation, the situation is getting better over here, even in terms of the medical facilities, because at many places we are seeing the beds are getting available, because the numbers of positive cases are coming down. Also, that people who are having mild symptoms, or they are not symptomatic, they are getting treated at home with home isolation and with the minimal treatment required from the doctors. So under the guidance of proper medication, under the guidance of doctors, these people are getting treated themselves at homes, and that is why beds are left for the critical patients. So beds are more beds are available for many critical patients. Apart from that, Oxygen Express, the tankers carrying out liquid medical oxygen from different states are already reaching Maharashtra, and also inside also in the state also many factories have started setting up their oxygen generation plants. So now we are almost ready for the third wave, if that is going to hit us, because many ministers, including Union Minister Nitin Gadkari, they have hinted that third wave of the COVID-19 will hit us soon, and we should be prepared for that. Because the first wave, we were still preparing things. Second wave, we had become careless about the fact that the whole pandemic numbers were coming down. So the pandemic situation is over, but now we have to be ready about the fact that the third wave would hit us, and it would be soon, saying the fact that it will be in July, or till July, from July till September, anywhere in between, that could hit us. So we should be prepared. Medical facilities should be prepped up. People should not become careless, and they should be following COVID appropriate behavior if they want to avoid facing the third wave of COVID-19, and also face the lockdown like situation that is there in Maharashtra. Abhishek.
Indeed, Shama, and also whenever we talk, we also talk about people's behavior also, whether they are following the COVID appropriate behavior or not, whether they are wearing masks or not. But it's good, we are hearing from you that people have now started following all the restrictions, all the government protocols also. And this was the reason why the Chief Minister of Maharashtra, Uddhav Thackeray, also said a couple of days ago that there is no need to impose a further strict lockdown, which is very, very good sign. Thank you, Shama. Thank you for giving us that information. In the assembly elections held in 4 states and 1 union territory, the ruling parties retained power in Assam, West Bengal and Kerala, while opposition parties will form government in Tamil Nadu and Puducherry. West Bengal Chief Minister Mamata Banerjee came out on top, fighting off the stiff challenge posed by the BJP, though she herself lost her Nandigram seat. In Assam, BJP has retained power. The Left Democratic Front would secure a second term. In Kerala, in Tamil Nadu, the DMK-led alliance would topple the AIA-DMK government, and there would be a regime change in Puducherry. It is to be noted that the final results of Tamil Nadu are still awaited. In West Bengal, according to final data released by the Election Commission for 292 seats, TMC has won 213 seats, BJP has won 77, others have won 2 seats. Meanwhile, despite TMC's stellar performance in the assembly polls, Mamata Banerjee herself lost the polls to BJP leader Suvendu Adhikari in Nandigram. Suvendu Adhikari got 1,09,673 votes, while Mamata Banerjee got 1,07,937 votes. And Prime Minister Narendra Modi has congratulated Mamata Banerjee for her party's win in West Bengal. In a tweet, Prime Minister said, and I quote, "Congratulations to Mamata Didi for Trinamool Congress win in West Bengal. The centre will continue to extend all possible support to the West Bengal government to fulfill people's aspirations and also to overcome the COVID-19 pandemic." Prime Minister also thanked the people of West Bengal for their support to party. PM said that I would like to thank my sisters and brothers of West Bengal who have blessed our party. From a negligible presence earlier, BJP's presence has significantly increased. BJP will keep serving the people, and I applaud each and every Karyakarta for their spirited efforts in the polls. Meanwhile, Bharatiya Janata Party said that it will play a constructive role as opposition in West Bengal.
वेस्ट बंगाल के विधानसभा चुनाव में जो जनता ने मैंडेट दिया है, हम उसका स्वागत करते हैं, सम्मान करते हैं। हम एक विपक्ष की भूमिका में रहेंगे। जनता का मैंडेट है, हम इसको स्वीकार करते हैं। और ममता जी, आपको बधाई देते हुए विश्वास दिलाना चाहते हैं कि हम एक सक्षम विपक्ष की भूमिका में सदन में रचनात्मक, जहां पर भी आवश्यकता होगी विकास में, हम आपका सहयोग प्रदान करेंगे। एक बार फिर से आपको बधाई और शुभकामनाएं। साथ ही निवेदन भी है कि प्रदेश के अंदर एक अराजकता का माहौल बन गया है। हमारे कार्यालयों को आग लगाई जा रही है, हमारे कार्यकर्ताओं को घर में पथराव किया जा रहा है, महिलाओं की पिटाई की जा रही है। कम से कम इस प्रकार की अराजकताओं को रोके, अपने कार्यकर्ताओं को अनुशासित में रहने की सलाह दें।
Right, violence broke out in West Bengal after the assembly election results. BJP's office was burned down in Arambagh, reacting to which BJP leader Sambit Patra has lashed out at the TMC.